My name is Tammy Johnson, and I am coming to you all from the big state of Texas after that horrible, horrible winter storm that we had last week. But we are recovering and we're better. We are slammed this week with requests. We have a lot of people who are still in hotels and um, needing water and things of that nature. So, super, super busy week for us. But I am excited to be here with you guys. So it sounds like I have a lot of young scholars, right? Are we high school students?
Yes.
Awesome. I'm a mom of six. That's not on my little introduction here, but I'm a mom of six. I have three girls and three boys. Four of them are adults out in adulting. And then I have two little ones that are 10 and I'm sorry, 11 and 12. So I'm excited to be on with you all to bring you some information in regards to the social determinants of health. And I'm excited that I can present it to you at this age and this stage of your learning process because maybe it will spark some interest for you all on how to be advocates for your communities and how to recognize some things that probably you would have never thought about had you not been a part of the presentation. So um, again, I am the founder and executive director of a nonprofit organization here in Dallas, Texas, empowering the masses. And I did founded it out of my past experience as a teen mom and a woman who was able to overcome all of her obstacles and go to college and be successful and have children who never experienced poverty and things of that nature. But I am a product of those things. But the more you know, you can change the trajectory of your life. You're not a sum total of how you started, it's where you're going. And so I've been in the medical field for 23 years. Um, and I am very passionate about teaching individuals about how to take control of their health because I've seen quite a bit of things in different communities. And I've worked with people from all socioeconomic backgrounds, grounds, from the poorest of the poor to the richest of the rich. I've seen them all. And I note that there's a big disparity in those communities. Before I get started, Ms. Janera and Don, do you have any questions or concerns for me?
No, I'm good, Miss Janera. What about you? Or does any of the participants have any questions, comments, or anything they would like to add?
I would just love it if you could share if there was any specific experience that caused you to go into the field that you chose to go into. I know that you said that being a product of the environment that you were in really drove you to want better for yourself. But was there any specific influences, any people in your lives, any acts of kindness that kind of drove you to do this work?
Um, to be honest with you, remember I mentioned in the top of my introduction of myself that I was a teenage mother. However, as a young woman at about the age of 13 or 14, I was exposed to an organization that is now known as Texas Workforce Commission. But at the time, it was called Private Industry Council. And what they did was go into underserved communities and offer teenagers the opportunity to work for the summer and to get paid. And in the process of us working for the summer and we were getting paid, they trained us on soft skills and they trained us on how to present ourselves and how, I went to predominantly Caucasian schools. And so I was able to articulate well, but it was things that I needed to know to be successful in the workplace. And so and again, growing up in a place of poverty where no one worked, we were hungry oftentimes, we didn't have food. Sometimes we were those kids that had to wait to go to school to eat on that Monday or Tuesday. And then Friday, Saturday, Sunday, we didn't have anything to eat in the evening until we went back to school on Monday. And so when at 14, when I started to work with this organization for the summer, something clicked for me. I was like, oh my gosh, in order not to be in poverty so that I won't be hungry, all I have to do is go to work. Hmm, that's interesting. And so my path started out, I was a banker, to be honest, quite honest with you. I started out in banking and I worked for Bank of America for a while. And Bank of America and Nations Bank merged. And when those two banks merged, they cut our hours. And so I went from working 40 hours a week to working 20 hours a week. And I was like, this is not going to sustain me and my family. We need to do something different. And so I went to a hospital to apply for a job. And even though my credentials were, or my experience was, of a banker, I didn't care where I worked. I was like, I'll just take a job in the kitchen or whatever. And they were like, no, you're not, you're too qualified to be in the kitchen. I was like, okay, fine. And so that was 20 some odd years ago. So you can't do that now, right? But so they were like, let's take you back here to this recruiter. And I talked to the recruiter, and the recruiter was like, I think that you would be great as a unit secretary, and then you can cross train for other things. And so I started out in the medical field as a unit secretary. And back then, that's when we had flip charts and we had to transcribe doctors' orders and communicate with the doctors and things of that nature. And I was like, this is my place. I found my people. This is what I want to do. I like taking care of people. I get an instant gratification. People feel better after I've been in contact with them. So then I cross trained to be a patient care technician. And then I got more, experience with taking care of patients. So from a patient care technician, I went to school to be a medical assistant. From medical assistant, I went to school to be an LVN, and then I just kept progressing from there. And then at this stage, then I went to nursing school, and then at this stage, I'm an educator. So I teach nursing classes, in addition to um, now running my own organization. But it was all a gradual process. It's not what I dreamed about doing at 12, because, of course, there was no paradigm of excellence in front of me. So I had no dreams, right? I only saw what was in front of me and what was presented to me until someone reached out and gave me an opportunity and said, hey, guess what? If you work, your life can be better. Your life can be different. It'll be, you get out of it what you put into it. And so this is why I am where I am today, because you know, each one reach one is my dream. Each one to reach one is my belief. So somebody from Private Industry Council reached back into my community, my underserved community, and pulled me out of that. And now I am where I am. And I feel very passionate about making sure other people do the same and I do the same. And so that's where empowering the masses came from. Empowering the masses one person at a time, based on the experiences that I received. Now, yes, I did mention that about 17 I became a teenage mother, but you would have thought it was a setback for me. It was not, because of the experience that I had growing up. It was I guess a motivating factor for me, that hey, now you have these children, this child, you cannot go back to the life that you had as a child growing up. So what are you going to do? There will be no excuses. Go to work, go get your education, make sure that your children will never experience, hunger, never experience being cold, never experience not having clothing, the basic needs, right? Not even the most expensive things, but just their basic needs met. And so again, this is, why I founded my organization, and why I'm passionate even as a teacher, teaching my students at the college that I teach, because it's not where you start, it's how you finish. So, but in order to do it, you have to get started. So I hope that answered your question. Maybe too many things, but I hope that answers your question.
Absolutely. That was a wonderfully motivating experience. Honestly, I'm very proud to have met you with a
Mhm.
story of rising from ashes such. The reason why I asked is because I figured from the little bit I do know about you and from what I've seen on my perusing of online, that you did have a very interesting story. And I think it's relatable for a lot of our participants, maybe not all the aspects, but certain aspects. And that belief that, oh, because I've come from a certain background, I'm probably only going to get a certain step above that. And so having you say, this is what my environment was when I was growing up, and I was ensuring that my children wouldn't grow up in the same environment, that generational progress is something that I definitely want to instill in our participants, that goal to be the next generation, one step further, two steps further, three steps further. And so I thank you for being so open and sharing that all with us. And I'm looking forward to hearing what you have to tell us today.
Thank you, thank you. I'm excited, and thank you for stalking me online. Just that was just a joke, but um, so I'm excited to get started today. Like I said, I'm a mom of six, so I'm very, motivated to make sure that everybody has as much knowledge as they can to equip themselves to be advocates for their community. Um, And so, with that being said, today's goal is to kind of teach you a little bit about the social determinants of health. And what I did not mention in my introduction as to why it's important for me to teach and talk about health equity and the social determinants of health, because along with the things that I told you about, how I grew up and how I ended up where I am, I experienced some things once I received the knowledge that I was able to look back and say, hey, that was health inequity. Hey, my mom didn't know this, so she didn't ask these questions. Hey, I could have been a victim of that had I not had the knowledge. And so it's super important to me to try to share as much as I can with other individuals, um, in order for you to go out and advocate for your family, or and even advocate for yourself, especially in the climate that we're in right now with COVID-19, and things of that nature. So by the end of this presentation, there's a lot. I don't know if you can see at the bottom, there's 47 slides. I'm not going to go through all 47 slides. You will see me skip some of them, but I will stop and talk about the ones that are super and most important to me. So by the end of the presentation, I am hoping that the students and all participants will understand what it means by the social determinants of health, how the social determinants of health impact a person's health status, why is it important to address that, and then terms associated with it. And then again, why is it super important for you to know and understand what that means and what it entails? Now, there's this organization called WHO, and you've probably heard a lot about them, in the last year with COVID-19 and the pandemic, and all of those things. And they're the people who talk about what are some factors that, cause people not to be healthy. What are some things that cause communicable diseases? What are some of the social determinants of health? All of those things. They keep those things in check, and they kind of do studies, and they look at neighborhoods, and they try to figure out what's happening in these neighborhoods that's causing people not to be healthy, or people not to live a long time. And what one of the things in my research, and one of the things that I've learned, is that people, a lot of these organizations have pinpointed how long someone will live based on their zip code, based on their neighborhoods, based on the things that they're exposed to. So when we're talking about the social determinants of health, it's five categories that come into play. Okay. So generally speaking, it could be genes, your biology, if you're male or female, your age, what are some of your health behaviors? For example, if you use alcohol, if you use drugs with needles, if you have unprotected sex, if you smoke cigarettes, if you smoke marijuana, it may be legal in some states, but it's not healthy for you to do those types of things, because has a lot to do based on your genetics and where you come from, and how it can affect where you're going. So just note that again, it may be legal in some states, but based on your genetics, it may not be the best thing for you to do. Okay. So, according to the World Health Organization, the social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health states uh, within and between communities. Well, and it should have been health status. So, remember, we talked about I've worked with the poorest of the poor, and I've worked with the richest of the rich. And I've worked for Dallas County Hospital, and then I worked for a private hospital, UT Southwestern. And there was a big gap between those two individual hospitals. When I worked for Parkland, the county hospital here in Texas, here in Dallas, and I worked in the geriatrics department. We had a lot of people that were ages 50 to 60 years old, but they had health problems as if they were 70, 80, and 90. And then fast forward to me working at UT Southwestern, I had those same people with the same age that were 50, 60, and 70, and they looked every bit of 30, 40, and 50. And it all was based on their social economic status and where they lived and what they were exposed to and the information that they received and people who were advocating for them on their behalf. Okay. It says many people face barriers that prevent or limit access to needed healthcare services, which may increase the risk of poor health outcomes and health disparities. Okay, so again, what are some of those social determinants of health? The economic stability. Do I have a job? Am I able to work, and am I able to provide for myself? Am I able to buy food? And I'm able to make enough money that's going to help me provide healthy foods for myself. Okay, my education. Do I have enough education that's going to help me have economic stability, because now I have a job that's going to provide insurance for me, and that's going to provide the opportunity for me to have education about my health, and again, provide for my family in a good way. Social and community context. That's who I live with. That's the family. That's who influences my decisions. I do remember working for Parkland, and I went up on a unit, and I had a young man that was 26 years old, and he had his whole life ahead of him, but he was sitting there in that hospital with the health of a man that was 50 or 60 years old. Why? Because he chose to do some things based on what was around him, starting at the age of 13 and 14 years old, that caused and put stress on his heart. And now he had all of these heart issues and, all of these things. And I asked him, why did you choose to do drugs? Why did you choose to drink? Why did you choose to do all of these things? And he was like, well, that's all I saw. My mom did it, my did it, my uncle did it, my cousins do it, everybody does it. And now he's 26 years old, and he is now having the health issues of a senior citizen because of, again, his community and the things that were around him, and he felt like he had no other choice. When we talk about social determinants of health, it's directly related also to who's around you. You're not a sum total of your genes. A lot of it has to do with sometimes your social and your community that you're around, and the things that influence you and some of the decisions that you make. Okay. Neighborhood built an environment. I kind of already alluded to that kind of thing, right? And then the theory is that in order to fix healthcare, you have to fix these items first. You got to help people have economic stability. You got to provide information to individuals and let them know the importance of education. And I'm not saying that you got to get a master's degree or you got to have a PhD behind your name, but some semblance of education higher than your high school diploma. I don't care if it's a trade school. I don't care if it's a certificate. Find something that's going to help you have sustainable income. Find something that's going to provide economic stability for you. Now, some of you are, most of you, and many of you are in high school. And again, I'm a big advocate of college, and I'm a big advocate of education. But what I want you all to do so that you can have economic stability, right? And so that you can have a way to provide for yourselves is with Miss Janera and Miss Dawn, map out what your careers are going to be, right? And some of your careers will be, I need a certificate. Some careers will be, I need a trade. And some of your careers are going to need a master's degree or a doctorate degree or whatever it's going to be. But it's important for you to understand the importance of that so that you can have economic stability. And that's going to come from educating yourself. Okay. And the more education that you receive, the more you can realize, and your eyes will open, and you can open doors for those in your community. Now, included in these categories of economic stability are employment. Remember, employment is super important because remember, I told you that I didn't learn until I was 14 years old. That in order, all I had to do not to be hungry is to go to work, right? And to be able to provide for myself, right? So my ability to be employed at the age of 14 in turn helped me have food security, right? I was no longer food insecure. I didn't have to worry about my mom no longer having her benefits that she gets at the beginning of the month loaded onto her food stamps card or whatever she had at the time. And then it ran out at the end of the month, and then we were hungry until her next benefits came in. When I educated myself and I realized that all it took was for me to be educated and me to become employed, I eradicated my food insecurity, right? And then the housing instability and poverty, and then employment barriers to consider. These are things that you need to know about as it relates to economic stability. First, education, then employment, and all of those things. Now, when we talk about health outcome, a lot of people believe that your health is directly based on your genetics, and it's not. Now, your genetics do play a factor in it. However, most of it comes from your socioeconomic conditions. Are you stressed out a lot? Are you living in an area that's detrimental to the way you live? It's not safe. For instance, if you're telling a diabetic person that you can manage your diabetes if you just go exercise, if you just go walk for 30 minutes a day, but they live in a place that has high crime, they live in a place, there are no parks, there are no trails, there's nothing for them to do. How many of them are actually going to take a walk 30 minutes a day? That's not going to happen. Okay. Behavior, again, the things that you choose to do. Are you choosing to smoke cigarettes? Are you choosing to drink? Are you choosing to do all of these things, right? Healthcare activities. Do they have the income that they need and the insurance they need to go see a physician or see doctors? And then again, back to the environment and the things that they're surrounded by. All of these things have a huge thing, in shaping the health of individuals in our communities. Now, and then we have economic stabilities. It says persons who are unemployed or underemployed will most likely have not have access to health insurance. If I don't have access to health insurance, I'm not going to go see my physician. I'm going to self medicate. I'm going to assume that this is just how I feel. It says persons who are unemployed or underemployed may also have issues with food security, inadequate housing, access to medical services, and transportation. And we still see that right now today in 2021. So many people are food insecure right here in America, which is supposed to be the richest place in the world, right? But we have the biggest number of individuals who are food insecure, okay? And don't have adequate transportation and don't have access to adequate housing and things of that nature. Food insecurity barriers to consider. I run a food pantry every week, and we serve about 260 to 270 individuals. Families, which is about 1,000 individuals a week. And the neighborhood that we serve in is considered or known as a food desert. We're in America again, remember, right? The richest place in the world. But I operate and I serve more than 1,000 people each and every week because they live in a community that's considered a food desert, meaning they have no grocery stores. They only have liquor stores, they have the corner stores and things of that nature. And guess what? Even if they do have a job and they get to their job, by the time they get home and maybe don't have a good car, they're on the bus. By the time they get home, they're not going to take two more buses to get to the grocery store. So what are they going to do? They're going to take the little money that they have and go to the local grocery store. And what's at the local? I'm sorry, not the local grocery store, but the local corner store. And what do they have at the corner store? They have all these prepackaged foods that may or may not be in date, but if they are in date, they're high in sodium, they're high in carbohydrates, they're high in all of these things that's going to turn around and cause health problems for them, all because they don't have economic stability and all because they don't have access to a grocery store. So what happens? They eat that way, their children eat that way. So now we have this high issue or incidence of kids at age 12 and 13 who have high blood pressure and diabetes and all of these things because of the inadequate economic stability. Before I move on to the next thing, do y'all have any questions? I want to stop right here and take any questions from you guys. Okay, no questions. All right. So we talked about, and now we're going to talk about some things, some other things that relate to housing
We have some
stability.
questions in the chat.
I
Miss
can't see
Mary.
the chat, so I might have to get somebody to read it for
Oh,
me.
I got you. Yeah, no, it says,
Okay.
how do you start a food pantry? Sana asked.
So for me, for the food pantry, it came with me starting my nonprofit, Empowering the Masses. And with me starting the nonprofit, Empowering the Masses, then I was able to go out and ask for donations from different grocery stores, become partnerships with my local food pantry, my local big food bank. That food bank can trickle down. We can pay 12 cents a pound for the food, which is great, right? If I pay 12 cents a pound for the food, I can provide 3 meals for $1 for a person, but it started with me starting my nonprofit. But you don't necessarily have to have a nonprofit. If you have like the school that you go to, you can start a food pantry at your school. You can ask, your teachers, you can ask community that, ask the community, hey, we have this amount of kids at our school who are food insecure. We want to make sure that these kids have something to take home on the weekend. So you can do like a backpack program, at your school where you have an area in your school, maybe an old closet, place where they keep, papers and things of that nature, and you clean it out. And then you decide to take some of your allowance if you have an allowance, or you take, pennies or crushed cans or whatever you need to do, and you go out and purchase foods and you keep them in your, food pantry, at the school. And then each weekend you have a place where kids can come and they can say, hey, I'm gonna need food for the weekend. You give them a little backpack or whatever, you fill their backpack and they can take it home for the weekend. And we do that, for our food pantry as well. So you don't necessarily have to have a nonprofit. You can just start it with people in your community. Two or three of your friends, tell two or three of their friends, tell two or three of their family members, tell two or three of your local community stores and things of that nature, and tell them what you're doing. People will be willing to help you eradicate hunger. So you just have to have the willingness and the passion to do it. Any other questions? I hope that answered your question.
She says thank you in the chat.
You're welcome. Okay, so it says economic stability, housing instability barriers to consider. Families that pay too much for housing have less money for necessary expenses and health insurance. So, what does that mean? We have a lot of places that are too expensive for people to live, right? So, if I make $1,500 a month, but my rent every month is $1,300, am I going to really have adequate food? Am I going to really have adequate insurance? Am I going to really think about paying my copay to go to the doctor if I have a cold or a cough or something? Probably not, because I don't have adequate housing. It says pregnant women who are homeless are more likely to have low birth weight and preterm babies. Now, not necessarily just pregnant women, disproportionately African American women and brown women are disproportionately affected by preterm babies, low birth weight babies, because they have this thing called the cortisol effect. And I'm sure you've heard of cortisol before. And if you haven't, it's that fight or flight thing that you have, and you either run away from something or you stay and you stand your ground. Well, because these communities are disproportionately affected by violence and homelessness and low economic statuses, they live in a place of stress all of the time. And it disproportionately affects them and it causes them to have preterm labor. Doctors don't take them seriously. They don't take them seriously when they come in and tell them, about their symptoms. And so a lot of times you have low birth weight babies, preterm babies, or babies born with issues and disabilities, disproportionately in the Black and Brown community. Um, Home foreclosures and evictions can lead to suicides. Why is that? You don't have any place to live. That's just your basic need, right? A place to lay your head that you're going to feel that it's safe. And children who are moved frequently have more chronic conditions. They have, asthma, they have disabilities, inability to learn and retain information, things of that nature because they don't have a solid foundation. Then some other barriers can lead to issues with health insurance. Again, we already talked about food insecurity, inadequate housing, and access to medical services and transportation. Now, when we're talking about education, this is very important. This early childhood education piece here. And again, I had to learn that as I got older. This is not something that was taught to me. And then when I became a mother, I realized how important it is that people understand and people learn. So if you have siblings, younger siblings than you, it's important for you to understand that this piece right here, as it relates to education, is not when they get to elementary school, it's not when they get to high school or junior high school. This part of their education and development starts like at 2 and 3 years old. I found it important, for me, my son who's 23 and my daughter who's 25, to make sure they were able to read before they got to kindergarten. Why? Because if not, they're going to start behind the curve because of their ethnicity, often because of their color and things of that nature. So early childhood education is important. So if you want to grow up, you want to become a teacher, and you want to advocate for that, Head Starts in your communities. Um, Preschool for kids and children of color is super important to get them on that path to already being aware and understanding how important education is. Enrollment in higher education. Okay. Again, I'm not always telling you that you have to go and get a master's degree, but you got to get something higher than your high school diploma, something that's going to help sustain you and help you be employed and help you have health insurance and things of that nature. And of course, graduation from high school. Okay. Language and literacy, early childhood education development barriers to consider. Children who do not receive early childhood education are less likely to read at grade level. So again, those of you who have little siblings and you have, or when you decide you want to grow up and you want to become a parent, understand, don't wait for them to get to kindergarten or don't wait for them to get to preschool to start teaching them or introducing education. It's super important to start as early as possible so that the baby and the child does not start behind the curve. Okay. If this is not happening before, if they're not learning sight words, if they're not learning how to count and all of those things ahead of time, the possibility of them entering school at grade level is going to be diminished. It's going to be low. Okay. And then this can lead to literacy issues. And oftentimes you have those black and brown children who don't communicate often, that they're not understanding the information because they don't want to be seen as not intelligent or having an issue. So they'll just be quiet. They won't say anything and they'll slip through the cracks. Let's talk about, some barriers and some things that can happen if we don't graduate from high school. It says persons who do not graduate from high school are less likely to obtain employment that will support them and their families. High schools with less funding rarely provide advanced or honors classes. Again, those high schools that are in those lower socioeconomic neighborhoods don't often provide, students with information about how to increase their education or how to what they are qualified for, the things that are out there to help them. This, other than them going to a four-year university. Okay, language and literacy barriers to consider. Health and literacy is linked to overall literacy, and I want to ask this question: why do you think? Somebody tell me. If it's in the chat, I can't hear you, so you may have to unmute yourself. But health and literacy is linked to overall literacy. Why do you think that is? Why do you think those two things are linked? Your health and then your overall literacy.
Because the higher your reading level, the more easy it is for you to understand the language and the jargon that doctors use.
Right. And so why do you think that's a barrier in most lower socioeconomic neighborhoods or communities?
Since they
I'm
don't
just going up.
know,
Sorry.
my bad,
You're
you can
good.
go.
You're good.
I was saying that it's because they don't get the education that they need.
They don't get the education that they need, so they're not going to know what questions to ask, right? They're not going to know how to advocate for themselves. They're not going to understand what the doctor is telling them. I've gone into a community and I've taken care of an individual who had 5 different medications that he was supposed to take each and every day, but his education level was like at a third grade level. And so when we kept seeing him in the clinic, we kept trying to figure out why was he not getting any better. We had prescribed him medications. We made sure that he had access to the medications, but the problem was the literacy level. So we went into his home and I looked at the medications that he had, months and months of medication sitting on his table. And I was like, I'm just gonna say, Mr. Jackson, why are you not taking your medications? He's like, I am taking my medications. I'm supposed to take one each day, right? I have 5 medications. I take them Monday through Friday. He did not understand based on what the doctor had explained to him before he left the hospital or the doctor's office that he had 5 medications that he needed to take all 5 each and every day. You know, but he never made it past the 6th grade, right? So then he didn't understand. So now he's having issues with his health because he was not understanding the importance of taking care of his health or how to ask questions, or no one explained it to him in a way that he would understand it. Now, some other things that are social determinants of health: discrimination, incarceration, social cohesion. It says discrimination barriers to consider. Discrimination can affect employment opportunities, access to care, and access to adequate housing. Even know about what it means or how it relates to access to housing and as it relates to discrimination. What are some of the terminologies that they've used before? Or some of the things that they use to discriminate for people to make sure that they have great housing or good housing that maybe you've heard used, words you've heard used in the past?
Redlining.
Redlining, very good. I was hoping that somebody knew that. Redlining, and this is not something that's new. This happened back in the 60s and the 70s. This happened from a long time ago, where you may make the money, right? You may, have the education. You may be able to afford a house, a home in a certain neighborhood. But because of redlining, they've discriminated against a certain group of people, typically most often people of color, right? Not necessarily just black and brown communities, but a lot of different ethnicities, because um, of the redlining where you can't live in certain neighborhoods. So now you're all left to one area, one neighborhood, right? And that's where all of the liquor stores are. That's where all of the power plants are. So now we get into environmental issues. We're getting into, again, the social cohesion issues. Areas that are high in crime, areas that are high in incarceration, things of that nature. That in turn, what leads to poor health because there's no access to anything. There are no clinics. There's no great public transportation. There are no great schools. So all of that plays a huge role in um, our health. Now, what are some incarceration barriers to consider? Persons who are incarcerated have less chance of obtaining gainful employment. Persons who were incarcerated have addictions issues. They may have health issues related to the addiction. They may pick up some habits because they've been incarcerated. Um, Social cohesion barriers to consider. Social networks can spread through health behaviors, also known as social contagion, like sexually transmitted diseases. We have a whole clinic here in Texas for ages 13 to 21. And guess what? It's not in an affluent neighborhood. It's in a neighborhood that's plagued by violence. It's in a neighborhood that's plagued by liquor stores. It's in a neighborhood that's plagued by people who are living in a poverty situation. But we have a whole clinic for girls and boys ages 13 to 21, an HIV clinic. There's a huge outbreak in this particular community that we live in for HIV because nobody's coming into the community teaching them about sex education and things of that nature. And so we have a whole group of individuals who are infected with HIV in this 13 to 21 age group because nobody's talking to them about behaviors, their health behaviors and things of that nature. Examples are smoking, drinking, and eating behaviors. Lack of social cohesion can lead to isolation, insomnia, and emotional distress. Why? Because you don't feel safe. You don't have a great neighborhood. You don't have access to the things that are going to make you better than where you are, or show you that there's going to be a way out. Another thing, another social determinant of health is the neighborhood that you live in. And I think I mentioned this quite often throughout the presentation so far. Crime and violence. What are the environmental conditions? What quality of housing, are you living in? Are these houses dilapidated? You know, are there something that you are, proud to come home to? Is it a place that's causing health issues? Is there lead-based paint? Um, Again, are you able to go outside and play in the park? Is there a park at all? And is it an area that's plagued by crime? So even if you wanted to exercise, are you able to do so? Probably not. Says violence can lead to premature death, physical pain, mental distress, and reduced quality of life. The neighborhood that my nonprofit serves is known as South Dallas. Okay, we have a huge high rate of crime, a huge rate of sexually transmitted diseases, a high number of individuals who are addicted to drugs, a high number of individuals um, who have been incarcerated before. But if you come to the neighborhood, you will see why. There are no grocery stores, there are no educational programs, there are no parks. But again, what there are a lot of is liquor stores, old dilapidated high schools, old dilapidated elementary schools, old books, underqualified teachers, not enough resources for the teachers, in those neighborhoods and in those areas. And so if that is all you see each and every day around you, you can't see anything outside of that. You're going to just continue to repeat the cycle of the people that are in the neighborhood around you because of where you live, and nobody's bringing anything else or anything new into the situation and bringing and showing you something different. Okay. And then again, it says child and adolescent exposure to violence can result in a greater risk. What? Either them being a victim of violence or them committing, crimes of violence. It says
I,
pour water. Go ahead.
um, so what stops supermarkets from coming into food deserts?
So, and that great question. So a lot of the times is they don't feel like they're going to earn enough money, and again, it could be the neighborhood itself that's not attractive to them. They feel like it's not going to be safe. If I bring my store to this neighborhood, am I going to have to spend extra money on security? Am I going to have extra cameras? Are the police going to respond if we're robbed? Are people going to come and buy? Are these people going to steal from me? They have to ask themselves all of these questions. And so if they don't feel like it's going to be conducive for them as a business, they're not going to bring their neighborhoods there, their business there. And again, what happens is in these neighborhoods where these grocery stores that don't want to come in, there are no advocates for the people in those neighborhoods, right? There's nobody saying, hey, we have people here that work because there's a lack of transportation, they can't get to the grocery store. But if there was a grocery store within walking distance, they will spend their money at your grocery store. We will advocate to make sure that your grocery store is safe. So it is okay to bring your grocery store here. But again, if nobody's advocating, if nobody understands the importance of that, then the neighborhoods are going to just be just going to go without. My people perish for lack of knowledge. If I don't know, you only know what you know. If I don't know that I can advocate for a grocery store in my neighborhood, if I don't know that I can get people together to help bring quality foods in, if I don't know that, even if you don't have a grocery store in your neighborhood, what about um, starting a community garden in your neighborhood? Let's we can start there. I may not be able to have a big name grocery store come into my neighborhood, but I can start a community garden. We can do a community garden out of a dresser drawer. You can have um what is it called? um, in the neighborhood where my food pantry is, across the street, there's a community garden, and they don't necessarily have the actual soil because it's a lot of cement there, but they have planter boxes and things of that nature that they grow, Swiss chard in, and they grow broccoli in, and they grow um, zucchini in or squash in because they're trying to be advocates for the neighborhood. But the biggest reason to answer your question is because they don't feel like they're going to make money, or they feel like they're going to be victims of violence and they're going to have to end up shutting down. And again, there are no advocates to say, hey, we're going to make sure that you're safe. Hey, you're going to make money when you come to this neighborhood. It's super important to change the trajectory of the lives of the individuals in this community. So it's super important that you come into our neighborhood and bring your grocery store. But again, there are not a lot of advocates on behalf of the people in the neighborhoods. And then the grocery stores don't feel safe if they come into that neighborhood. Does that answer your question?
Yes, thank you so much.
Hmm. Now, let's talk about some of the socioeconomic factors, okay? And when you look at a pyramid like this, you always start at the bottom. So the largest impact starts down here, and then the smallest impact is up here. So factors that affect health, socioeconomic factors, poverty, education, housing, and inequality. Again, look at the communities and the neighborhoods and look at the people who live in these neighborhoods that live in poverty most often, that live in those dilapidated areas. Okay. Look and see what those are, and then define and learn what the highest level of education is typically in those neighborhoods. You're going to see that's driving that poverty. Okay. So it says changing the context to make individuals default decisions to healthy. Okay. Again, remember I talked about what's in these neighborhoods that are considered that have food deserts or that considered ghettos or whatever you want to call them. Again, what do they have access to? They have access to foods that are high in trans fats. They have access to foods that are higher in fat. There's lots of tobacco there. There's lots of alcohol, you know, in those neighborhoods. And people say if we can just teach people how to eat healthy, if we can teach people how to be physically active, you can address that issue. You can bring all of that knowledge in. But if you're not providing the environment for it to happen, then that's going to be the biggest social determinant of their health, and it's not going to change because you're not bringing in a way for those people to feel safe and feel comfortable. We're making that change. These are some terms that I want you to know and you to understand what it means as you decide and choose to become an advocate, for your community. Okay. Now we're going to go through each one of them and figure out what they are. Okay. But you have community, you have health disparities, you have health inequities, you have health equity, and then you have social determinants of health. Now, what is the definition of that social determinants of health? And we've been talking about it the whole time, right? It's those life enhancing resources such as food, housing, economic, social relationships, transportation, and healthcare, whose distribution across populations effectively determine length and quality of life. Right now, today in America, we have people who don't have access to healthy, clean water in 2021. If I don't have access to clean water, I'm not going to, that's just the bare minimum of what I need to be considered healthy. And even right now in Texas, a lot of our people, as a result of last week, do not have access to healthy water. Why? And 99% of those areas that don't have access right now after just the storms of last week are those lower economic areas. Why? Because those pipes and things are out of date. Nobody was going in to figure it out. Those water filtration systems are not up to par and where they need to be in those lower economic areas. And if it until it becomes an issue for those areas that make the most money, nobody wants to address it. Okay. And community. It's a group of people with a shared identity, including living in a particular geographic area, having some level of social interaction, sharing a sense of belonging, or having common political or social responsibilities. Now, when you talk about the communities that people live in, it's important that when you go in and you try to help individuals or try to advocate for other communities or individuals who are in those lower socioeconomic places and those people who have higher incidence of health inequities, that you make sure that you come from a place of advocacy, not come from a place of why don't you and how come you don't and why don't you all and why is this not happening? And then you go in and you do your research and you try to figure out why is this particular community disproportionately affected, and what are some of the things that are the driving factors that's causing this community to be disproportionately affected, and then what can I do to change it? And you don't have to wait till you're, a 30-year-old adult. You can do those things now. You can go in into these areas that you know, even if it's an area that you're from, and figure out what are some of the things that are plaguing those communities. Is it high incidence of crime? Is it lack of access to healthy foods? Is there poor transportation? You can be an advocate right now at your age to figure out, hey, what's going on in these communities and how can I bring attention to it? How can I shed the light on these areas that are affecting these communities? Okay. And then health equity. What does that mean? Not It says the opportunity for everyone to attain his or her full health potential. Everybody should have access to adequate health care. Everybody should reach their full health potential. That's just a basic human right. But unfortunately, so again, based on where you live, based on where you come from, based on what your skin color looks like, based on your economic status and how much money you make, that's not always going to be something that's afforded to you. But it's something that should be given to each and every person that's just born. That should be a basic right. No one is disadvantaged from achieving this potential because of their social position or other socially determined circumstance. The distinct from health equality. Now, it's very different. Health equity means we're all on the same playing field. We all have access to the same thing. We all, no matter what I look like, no matter what I come from, the doctor's going to treat me the same as they treat my counterpart. Studies have shown that doctors spend less time in the room seeing patients, of certain socioeconomic statuses and socioeconomic backgrounds. They may have access to the doctor, but they're not going to be treated equally. So make sure you know the difference between health equity and health equality. Health equity, yes, now I have access to it. You put a clinic in my neighborhood, but are they going to treat me the same? Are they going to address my issues the same as they do as the people down the street? Remember in the beginning of my introduction, I told you that I worked at two different hospitals. I worked at the county hospital and I worked at a private hospital. Those hospitals were 5 miles apart from each other, less than 5 miles apart, maybe 2 to 3 miles apart from each other. Now, they were both hospitals, right? They both had an emergency room. They both had a geriatrics department. At the county hospital, they had that. They had home visits for the seniors at the county hospital. And then at the other hospital that was privately funded for people who were insured, they had a geriatrics department. They had home visits. They had a clinic right there in the community, but there was no health equality. They gave us health equity. They put us all on the same playing field. There's a clinic here for you. There's a clinic here for you. But what the people at the county hospital had access to was not equal to what the people at the private hospital had access to. The caliber of physicians, the caliber of resources, the caliber of information was not the same. So how do you change that? You advocate that whatever information that people in the higher socioeconomic statuses receive, the people who are in the lower socioeconomic status receive the same information. And if we are giving them the same information and maybe they don't have the education to understand it, it is my job as an advocate for that community to make sure that people will provide information in a way that this community can understand it, so that we can have health equality. The difference between health equity. Okay, says disparity is differences in the presence of disease, health outcomes, or access to health care between population groups. So, so in conversations like these, the terms health disparity and health equity are often used, and it can be challenging to distinguish the difference. Now, let me give you some scenarios on this, okay? Male babies are generally born at heavier birth weights than female babies, okay? Babies born to non-Hispanic Black women are more likely to die in their first year of life than babies born to non-Hispanic white women. Okay. The first scenario is, it says what? The first scenario was what? Male babies are generally born at a heavier birth weight than female babies. That's scenario number one. And then scenario number two, babies born to non-Hispanic Black mothers or women are more likely to die in their first year of life than babies born to non-Hispanic women. The first scenario is an example of health disparity. The difference between males and females in terms of birth weights is rooted in genetics. It all depends on what they had access to, the prenatal care that the mothers had access to, all of those things. Scenario number two is an example of health inequity. A higher percent of Black women experience poverty when compared to white women. So some of the differences in this scenario could be attributed to what they had access to. Did they have prenatal care? Did they take their prenatal vitamins? Now it says, we talked about infant mortality before, and I told you about the cortisol effect and how more often, Black and brown women have either preterm babies, or they have stillborn babies, or they have babies who die within the first year of them being born. And research suggests that the stress that African American women, or of communities of color, the stress that are in those pregnancies, the stress that are on those mothers are higher because of oftentimes of their socioeconomic status than those of women who are different than them. How do we change that? We have to address that. We have to make sure that we introduce things like meditation. We introduce things like counseling and mental health and all of those types of things. But oftentimes those things are not afforded to those different types of communities, or those two different communities. Somebody explain to me, or do you have a question about the disparity and inequity, or did that make sense to you?
It makes sense.
All right, so now I'm talking about that one. Okay, so it says here are some suggestions for the comparisons by definitions. And we talked about already the difference. And so hopefully I've given you a good example of what health disparity means, what health inequity means, what health equity means, and then what the social determinants of health are, right? So health disparities are the differences in health conditions, health status between groups. Things that are considered in health disparities are their race, their socioeconomic status, their sexual orientation, their gender, are they disabled, the geographic location, and there's a combination of all of these things. Remember, I mentioned at the beginning of my presentation. Right now, to this day, your health department in your state, the attorney general can pinpoint based on your zip code how long you're going to live. They can pinpoint based on your zip code how long you're going to live. If you're going to live to the age of 60, you're going to live to the age of 80, because of the differences in health disparities and because differences in things that are afforded to certain communities. They can pinpoint, your health department can pinpoint who's going to live a long life, and who's going to have a short life based on their age, their ethnicity, and all of those things. Okay. 6 ways to talk about social determinants of health and how you can start the conversation. Right now, attending a workshop like this, and hopefully it's not too much information coming at you at one time, but start a conversation about it. You know, what long before illnesses happen. Talk about what leads to diabetes. Talk about what leads to addiction. Talk about what leads to high blood pressure. Talk about it in your schools. Talk about it in your homes with your parents and or your caregivers. You know, all Americans should have the opportunity to make choices that allow them to live a long and healthy life, regardless of their income, education, or background. Your neighborhood or job should not be hazardous to your health. But remember, I mentioned before, we can determine based on a zip code that somebody grows up in, that somebody lives in, how long they're going to live. What type of health problems are they going to have? If I live in this, like right here, I told you in Dallas, and where my nonprofit is located, the zip code 75215, you can best believe that there's going to be a high incidence of people with high blood pressure. There's a high incidence of people with diabetes. There's high incidence of people with addiction. There's high incidence of people who are incarcerated. There's high incidence of people who have HIV, all types of things because of that zip code, because of the things that are there. Because again, there's no access to education. There's nobody coming in educating on how to change what they see in front of them. And so again, we can pinpoint based on your zip code how long you're going to live and what health issues you're going to have. If we can pinpoint based on your zip code what issues you're going to have, we should be able to take those same zip codes and pour our resources into those neighborhoods, correct? And teach those neighborhoods how to be different. Now, again, the World Health Organization, the CDC, has all of these numbers and they have all of these statistics about these neighborhoods and about these different ethnicities and these different socioeconomic statuses of people. They can tell me that people in these zip codes are going to live short lives. They're going to die early deaths, either by crime, violence, or huge health problems. But how come we cannot advocate for these same people in these same neighborhoods? Because nobody's having a conversation about what the social determinants of health. People in these neighborhoods assume that these things are just genetics. This is just, who I'm going to be because of my color, all of these things. Nobody's having a conversation about the social determinants of health. You now have to educate yourself. You have to equip yourself with the information to decide, how can I change it? How can I figure out, how can I go to my CDC website for my state? How can I go to the health website for my state? How can I look at the Attorney General's website for my state and see what they say about these different zip codes? And now, how can I, at the age of 16, 17, or 18, advocate for these areas? How can I figure out, okay, I don't know your zip codes in New York, but in Staten Island, right? But look in there, look it up in your state and see which areas have the high incidence of preterm death or early death in these neighborhoods. And if you can even figure out what's causing the death, you can find out if there's high issues of diabetes and high blood pressure and all of those things. And then you can advocate. Y'all can get together and you can say, hey, we're going to go and we're going to advocate on the behalf of these individuals in these communities. We're going to teach them how to eat healthy, even if they can't go to the park and exercise because it's not safe for them. We can do things like this, virtual Zoom classes, for people in those neighborhoods to teach them how to eat healthy with the little bit of money that they have coming in. Okay. It says your neighborhood or your job shouldn't be a hazardous to your health. And we talked about that already. Your opportunity for health starts long before you need medical care. So we want to do preventative, help with our communities, right? We don't want to wait till they get diabetes. I don't want to wait till they get high blood pressure. I don't want to wait till they get addicted to drugs. We don't want to wait. We want to we want to take preventative measures. We want to go into these neighborhoods where these kids, remember I told you right here in Dallas, we have a whole clinic of kids ages 13 to 21. And it's not just a few of them. There's hundreds of kids ages 13 to 21 who are HIV positive in this one area. Why? Because nobody's going to the neighborhood teaching them about STDs. Nobody's going to the neighborhood teaching about, how to keep themselves safe and what this actual disease is and how is it contracted and how is it spread from person to person. That's a part of that's the social determinants of health, lack of education, lack of information. Nobody's disseminating the information. You know, the opportunity for health begins in our families, neighborhoods, schools, and jobs. You are high schoolers. Now it's time for you to say, hey, what's causing issues in our school? What's the biggest issue that we're having in our school right now? Is it addiction? Is it teen pregnancy? Is it, STDs? Is it, high blood pressure? Is it, diabetes? What's happening in the neighborhoods that I'm living in and from where I come from? And how can we educate ourselves on how to change it? You know, you're not, again, your health is like 10%, your genetics is 10% of how your health is going to be affected. I think on a call that we did before, one of the ladies asked me a question and she said that she was adopted. And so she never knew her paternal parents, right? She didn't know her mother. She didn't know her dad. She didn't know where she came from. But when she got older and she was old enough to go back and research where she came from, she realized that they had, high incidence of cancer. They had a high incidence of diabetes and high blood pressure, but she never experienced those things. Why? Because she was never exposed to those things. Preventative medicine, right? Just because she didn't know and she wasn't exposed to it. So she had a better health outcome at her age. We can do the same thing if we go back and we can talk about it in our communities and we can go back and educate our communities. And again, you don't have to have a doctorate degree or master's degree or a PhD or anything like that. You just have to be willing to educate yourself on what's causing these same neighborhoods, these individuals to have these same health issues. And again, the question that you asked first, so it first starts with asking the question, why don't they want to bring their grocery stores into these neighborhoods? So you ask the question, right? You find out the answer, and now you try to figure out working on the solution. How can I bring grocery stores into these neighborhoods? How can I advocate? How can I get some investors? Wouldn't it be powerful if, I don't know, there's what, 26 people on this call, and then 26 of you got 26 more people, and then they got 26 more people to invest in a grocery store to bring it into a lower economic neighborhood? There's power in numbers and there's power in information. So it says, how can you work to address health inequities in the communities where you live and work? Okay, you have to have an action plan. If a hospital or community member wants to move forward on their journey to address the social determinants of health, some of the next steps include: consider how could attending to social determinants of health change how your patients and your communities live. What challenges might hinder your ability to attend to the social determinants of health, the issues. And then health is a whole person, not just symptoms in an exam room. So how can you figure out what's happening in your communities? How can you address it even as a high schooler? Again, attending workshops, asking questions, educating yourself. So maybe what somebody tell me, what's the biggest issue that you see right now in one of your communities that you see that needs to be addressed? Is there something that needs to be addressed in one of your communities right now?
I feel like in my community, there needs to be more mental health awareness.
And why do you think it's not happening, or why do you think nobody talks about it? Is it because of um, belief systems or stereotypes or stigma?
I think it's because of, Staten Island's a really conservative place, and
Mhm.
there's a lot of stigma around mental health, and some people just don't believe that it's a thing, but it is, and it affects a lot of young people, old people, and it's just something that we need to be aware of, and we can take steps to help.
Right. So again, this is your action plan, right? The first thing is recognizing there's an issue, correct? So you recognize that the issue is mental health. And even for me, in my community, as an African American woman, right? And then I'm married to a pastor. So that's a double whammy, first of all, okay? African American woman. So the stigma for me is just pray, just you'll be okay. There's no issue with mental health. Just walk it out. And then I'm married to a pastor, right? So everybody's like, just pray away, just pray it, just it's fine. Just pray about it and you'll be okay. So when you try to address that, hey, there may be a mental problem going on. There may be some mental issues. There may be some anxiety. There may be some depression. And it's okay to go and seek help. It's okay to go and talk to someone. So in order to be able to address it in your area, even though it's a conservative area, you got to remove the stigma from it. Okay. You got to remember and tell people, hey, your mind is a business. And if your mind's not functioning like it's supposed to, if there are some areas that we're not addressing, then the rest of you is not going to function properly. So we have to remove the stigma. And I think that's what happens, like you said, in those conservative areas, in those areas that are high, very, very religious. And then those areas that have had issues with seeking out help and people from outside of themselves. They're not going to want to go out and seek that issue. But you have to be willing to be an advocate in that area. Hey, teens are dealing with more, especially right now in the coronavirus. They don't have access to their friends. They don't have access to their social, groups. They don't have access to their sports and things of that nature. Is something that we have to address right now. There is an issue with mental health. There's anxiety. There's depression. All of these things that need to be addressed, that we got to address them right now. Or if we don't address it, it's going to get even worse, right? And then there's going to be a big fallout from not addressing these issues. Okay. Now, what do you need to do in order to address the issues that you feel that are plaguing your neighborhoods and that are plaguing your communities? You need to establish some goals. Decide what are some of the, like she said, Miss, I don't want to mess up your name. I'm going to just say Miss Ariba. Okay. You decided that we know that mental health is an issue in our neighborhood. Now we got to come up with an action plan to figure out how we're going to address it and how we're going to remove the stigma, even though this is a conservative neighborhood. Develop an understanding among staff members or your community organizations on how social determinants of health influence public health. If it's an issue for a huge population of people, it's going to be an issue for the public eventually if we don't learn how to address it. And then incorporate people with lived experiences into the decision making. So sometimes it's going to take taking and talking to those people who are, that going in kind of being like gangbusters and talking to those physicians and talking to those people who have um, higher roles in your communities, like your mayors or your politicians or your councilmen, saying, hey, this is an issue that is plaguing my age group. This is an issue that is plaguing my community, and I need you to help me advocate. I need you to help me bring awareness to this issue. I need you to help me bring attention to this in my community, so that we can make sure that we can stop the stigma here, that we can stop the issue here, so that we can bring awareness to it, and then we can change our community from the inside out. And then working with partners to develop sectoral approaches across sectors such as transportation, higher education, and then other community initiatives. So Ariba, you're wanting to address the issue of mental health in your communities. You may have to go outside of your community in the beginning to find some advocates and some people to teach you how they address it in their neighborhoods, how they address it maybe in other neighborhoods in other areas, and then take those tools back to your area so you can address it in that capacity. And then how do you change? Understand what creates health and the conditions necessary for optimal health. And then create an agenda, decide on how you can work to address and how you can go about doing it. And then advocate on behalf of individuals and communities and hold policies and protocols accountable. Even right now, today, as a young person, as a high schooler, you can figure out what the policies are for addressing mental health. Who has access to mental health? Who has access to health insurance? What's out there and what's not out there. And then bringing that information and knowledge back to the communities that need it and don't know what they have access to. But that was my presentation for you all today, talking about the social determinants of health and things that affect our communities and how you can be an advocate and how you can be a change agent for your community. I want to take this time to just, ask any questions that you guys may have for me.